I was in Res Life. I lived in Windsor for 2 years as an RA, and then I was a staff resident at Earhart. In med school, I went to Detroit, Wayne State. I did my clinical rotations at Detroit Receiving, Harper, and Henry Ford. And now in residency, I'm at Beaumont, Troy. I work with newborns through adults, all ages, stages, obstetric care. I just did so some cool stuff going on. You get to really kind of choose your own adventure. Today I'm going to be talking about some 4 main ethical principles that guide what I do every day. I'm going to discuss, we're going to go right into the weeds with abortion, a case-based framework to approach these kind of situations. I'll guide you through 3 cases that I've encountered in my career so far. We'll discuss kind of a note on silence, and then we'll apply the principles to your future careers. Okay, so we can start with this little poll. If you could scan the QR code with your phone or type in the link, whatever you prefer. Yeah, so just to get a feel, you guys got it? Yeah, so I want to know what field are you guys planning on going into? Just to help tailor the presentation at the end. Awesome. We'll come back to that. Thank you for participating in that. Okay, so the 4 kind of guiding principles of ethics that I referenced earlier include autonomy, beneficence, non-maleficence, and justice. So, let's see. So autonomy is the idea that you have choice, right? You can't force anyone to do anything. Let's say, for example, you are a physician and someone's coming to your office with breast pain, okay? And you palpate a lump and it feels suspicious to you. It feels like hard, irregular, it's like, hallmark signs of a cancer. And you say, I think you should get a mammogram, ultrasound, biopsy, this is what I'm recommending. Maybe it'll just turn into this easy fix. We'll get a lumpectomy, you'll be good to go for another 30 years, right? But if your patient is no, I don't want that, you can explore the values there, and you can't make them do something even if you think it's in their best interest. It's their choice, right? Then there's beneficence. This is the idea of doing good. It sounds really basic. So for example, let's say you are taking care of a hospice patient. Someone is actively, in the active stages of dying, and they're in a lot of pain. Maybe they have cancer pain. It's okay to give them morphine, right? That would go with beneficence. And let's say their family's surrounding them and this is a really hard time for them. Well, have you heard of the death rattle where you kind of gurgle, it sounds like the person's drowning? That can be really distressing for the family to hear that. And so you can give them a medicine called glycopyrrolate or another similar medication to dry them up so that their family isn't oh my God, is my loved one drowning? That's beneficence. Then there's non-maleficence, the very classic do no harm idea. So let's say you have a patient who comes to you, they have a history of seizures and they really want to quit smoking. And they're okay, my friend took Wellbutrin and they were able to quit smoking, so give me that. Well, you're okay, but that will decrease your seizure threshold. You're gonna have a seizure, brain damage, you could die. I'm not giving you this. And they're okay, I accept the risks, just give it to me. You have to abide by non-maleficence and say I cannot prescribe this and this is why. And then lastly, justice. This is the idea of treating people equitably, fairly. So a common ethical dilemma that uses justice is transplants. So let's say you have 10 people on a transplant waiting list and you have 2 hearts. How do you determine who gets those 2 hearts? How do you, it's a conundrum, okay? And it's an everyday thing of limited resources. So the most frequently referenced ethical dilemma in healthcare in America is abortion. So same link, let's say you're in an interview and you're asked to state your stance. So are you for abortion rights, against them? Is it case by case, or are you unsure? Okay. Cool. And so when thinking about why are we for it? Why are we against it? it's important to use like some critical thinking, some reasoning. So which, oh wow, you already did this. Which ethical principle most influences your take on abortion? Is it autonomy, the person getting the abortion like has the right to put whatever in their body, like it's their right? Is it non-maleficence, you don't want to harm the fetus? Or is it something else that I'm not thinking of? And if you said something else, which one are you thinking? That's okay. But yeah, so kind of like using your critical thinking. Okay, so the idea, you're in this interview, you present your argument. If your answer is situational case by case, like you said, work through each case. Show that you're thinking about it. Pitfalls, you state, you know what, I can see both sides, like I'm not sure what I would do. I can you might think you're trying to be neutral and like respectful, but it really comes across sometimes as like a failure to think critically. Like we want to know if you were in this situation, what would you be doing? The other kind of pitfall here is jumping immediately to your stance of like, for example, oh, I would never do it, I'd go to hell, end of story. Like, we need more from you when you're working through these scenarios. So here's my first case that I experienced as a third-year medical student on my first clinical rotation through urology, a surgical subspecialty. So first day in the clinic, about to do the first digital rectal exam, and this is where you take your finger and put it in someone's rectum to feel the prostate. You can see if it's enlarged, any weird lumps, you know, it's a screening for cancer. Or if it's a surveillance for someone if they already have cancer. So before you enter the room, like you're standing outside, my attending doctor was like, okay, I'm gonna do the exam, and then you stick your finger in right after me, so it's like a smooth exchange, so they don't even know. Because he was like, I don't wanna inconvenience my patients with like a student being here, but you still need to be able to do this. So I was like, oh God, what do you do here if someone's telling you, and they're your boss and they're grading you, like what are we doing? So yes, some internal discord, a little panic. But yeah, so I was like, yeah, okay, doctor, I'll do that. And then I walked in the room, he kind of motioned, he did his rectal exam, he motioned to me like, okay, go in. And I like couldn't, I was like, sir, is it okay if I do the same exam? And he was like, yeah. So, and then I did it and it was fine. And so the idea here, my ethical kind of guiding principles is like autonomy. I want him to decide, like, do I want a female med student doing this exam on me? And non-maleficence, like, is this gonna be traumatic for this person if I like, surprise, rectal exam, like, yeah. So those were my guiding principles. Did I get in some trouble? Kinda, yeah, I got really crappy reviews from this doctor, but whatever, like, I wouldn't have been able to sleep at night if not, you know? Next case, we're navigating diagnostic uncertainty. My first week of residency, first week being called Dr. Anything, and I'm on the inpatient service. We have a patient presenting with 2 weeks of abdominal pain and profound fatigue. So like all of a sudden, she's in her early 60s. She has this history of the MTHFR mutation. She's been so on top of it, getting all her colonoscopies because it increases your risk of cancer. CT scan that we got of her belly showed severe diffuse metastatic disease. Any organ you can think of in the belly, she had cancer on it. But the dilemma is you cannot diagnose cancer without a biopsy. There's literally no case when you can do that. You have to look at the cells and be like, yes, like they're showing atypia, they're showing this and that, like this is cancer. So basically like the oncologist, the cancer doctor is like not saying the word cancer because like there's no proof yet, right? So she's here in the hospital for like a week. Her pain is so severe, she's requiring IV pain medications. The oncologist at the end of the week is like, okay, she's good to go home, just give her some opioid pain meds, and we'll see her in the office. But at discharge, you know, I'm going to go through the meds with the patient, and I'm like, okay, like you're gonna start this and this, like to control your pain, and she's like, whoa. Like, I don't wanna get addicted to opioids, like why are you giving me this? I'm a Tylenol girly, like I'll be okay. And so you have to go, like, discuss with her, like, the indication for opioids in this case. Like, you know, the benefit of your pain management in the last months of your life is greater than the risk of addiction. But, like, what kind of counseling can you give her if you're like, skirting around her real diagnosis? So for her to have true autonomy in this situation to decide, do I want this medicine or do I not, she has to know what we're thinking and like our whole thought process. Like we just have to be honest, and it's a shame that no one was honest with her. And so me, the intern, had to go be honest with her. So set the scene on having a hard conversation. They're in their hospital bed, you want to be on the same level, I got a chair, you are making eye contact, you're asking permission, saying like, is it okay right now? Like, are you in a good space to have a hard conversation? Like, I want to know like your thoughts on and your understanding of like why you're in the hospital. Like, are you in a place to talk about that? And usually they're like, yeah, please, like I'm begging you. And then sharing what you suspect with honest clinical judgment, including your diagnostic limitations of like, you know, I think you have cancer. There's no way I can prove it right now, but I can't picture any other disease process that would cause like lesions everywhere like this, where you would go downhill so fast. Yeah, and just being there for them. And her reaction in this case, like she was so relieved. I was scared, like what is she gonna think of this intern going and telling her, like, and not her cancer doctor. And she, by the way, she didn't know what an oncologist was. She didn't have the medical literacy. Like, it's wild. You gotta like meet people where they're at, use language that they know, and just be so honest. Because like, isn't that what you would want with your family member or with you? Is like their honesty. Okay, last of these cases. This was also in my third year of med school at Detroit Receiving. So we have a 26-year-old man who's my age, so it really was like, oh. He was riding a bird scooter with his girlfriend at like 11 p.m. And he saw a car coming and was about to hit his girlfriend, and he dove in front of her to save her, and he did. He saved her life, but he was struck by the vehicle and his leg was crushed. He was found unconscious at the scene, transported to our hospital, rushed to the OR. They did a vascular surgery, because one of his arteries was sheared in his leg, and they tried to revascularize it, you know, reconnect the vessel, and they failed. And so they had to do a through-knee amputation because the limb would have died. On top of that, he's got this traumatic brain injury. He's got full body cooling to lower the metabolism of the brain. We drilled a hole in his head to like relieve pressure so that his brain wouldn't herniate. He is intubated, sedated for weeks, my whole rotation there basically. His heart stopped 3 different times, and that in itself like really crashes your prognosis. Like he's requiring CPR, ALS, and we don't know like how much of his brain is going to come back to us. Is he ever going to come back? Is he ever going to be the same guy? Or will he come back at all, right? So imagine you're the med student assigned to this patient. You are going in there every morning, 6 a.m., ugly early, and like doing your neuro exams, like checking the ventilator settings so that you can go back and round with your team and report on like, here's the status of the patient, here's the next steps. And so you're doing this, and then someone walks in the room, one of the nurses who hasn't been there in a couple days, and says, wow, I can't believe this dude's not dead yet. And she like yells that to the hallway and is like, oh my God. And like they're all laughing and you're like, whoa, this is a lot. Like I've known this patient for a week now. I'm so invested in their care and who they are and their personhood. And it just feels to me like this person's not taking their life seriously. Like how can you joke, you know? So what do? Do you snap back like immediately? Probably not if you're there as a rotator and like you're new to this environment. I would caution you for sure. The safe route is to just do nothing, fly under the radar, pass the rotation, just don't piss anyone off. But some alternative routes, like you can address it. You can say something. So how I addressed it, I approached the nurse later that morning after kind of gathering my thoughts, getting my cool, and said, you know, this patient's case has been something else. Like, the fact he's still here is, like, mind-blowing. It's just, he's against all the odds. And, like, in your job, I can't imagine how stressful it is to, like, lose patients all the time. But on the same note, like, I'm worried that, like, did he hear you? Like, could that affect him negatively? And so in the way that I addressed it, I was, like, validating her perspective, like, it is so exhausting work, like being an ICU nurse. Turnover is so high, you like will never see a middle-aged ICU nurse because they just burn you out. So I acknowledge like she's got a really hard job. And then also explaining like my kind of ethical principle here, like no one knows what someone's brain is really processing when they're sedated or in a coma. Who's to say, like, you know? So the risk here that I took was that she's a seasoned employee, I'm a student, like a third-year med student, like what is that? So especially with someone who's burnt out, they're not gonna receive it well, and it certainly wasn't. So yeah, she told my attending doctor that I was insubordinate, and I got in all this trouble for not respecting their hierarchy unconditionally. And yeah, so for a bit I was like, ugh, I wish I said nothing, this sucks. And then it all became worth it when, like one of the last days of my rotation, I walked into his room to do my rounds. I was doing my neuro exam, and I said his name, and he opened his eyes and gave me this big smile, and it was just incredible. The most like beautiful, stunning moment I've ever been a part of. And so I think like that's the principle of beneficence, right? Putting good out into the world, even if you don't know if it's being perceived or how it's being perceived, like you're putting it out there and it'll ripple however it will, but you've done like your part. And so he was perceiving me, he had heard my voice, and like, yeah, it was stunning. So, before stepping foot into your career, into your field, remember your values and do your best to stay true to those. Even if it's not what your boss values or what the patient is asking for, the customer wants, if you go in with this mindset that everyone else's values are more important than yours, they're right. Like your own moral foundation is bound to crumble. It is like exposed, under attack, malleable, and like we don't want that for you. That is a recipe for burnout. So know your values and know how to communicate those. At the same time, it's important to consider your safety. Like if I speak up, what are the consequences? Am I going to be at risk of losing my job? Is this job aligned with my values in the first place? Can I peace out? Or do I need this job like to live until I can safely transition somewhere else? So my own example of a time I've remained silent, and I'm actively remaining silent, is 24-hour shifts. So in some residency programs, including my own, you have to work these 24 to 28-hour grueling shifts. Most times you don't sleep, and if you do, it's bad for the patient. Like, you were out. Where were you? Yeah, so working on a sleep deficit is associated with increased rates of medical errors. It's associated with increased rates of worker suicide. And so I think we can safely conclude that these 24-hour shifts have the potential to do real harm to your patients and to yourself. So this doesn't go with my core principle of non-maleficence. Like on my last 24, less than a week ago, it was like hour 22, we just got a new admission, and I was so aware of how horribly my brain was working, and like, it felt like I was drunk, and it was horrible. I was so scared to make a mistake that would hurt this guy, and I didn't know what to do, but I just had to do it. So that's scary. When is it safe for me to speak up about how I'm feeling in these situations? So I could do it anonymously. We have some Google form that I don't know if anyone ever checks, but I could say, hey, I really don't feel confident, ordering the right dose of the right med for the right patient. Like, you'd be surprised how many times you order the freaking wrong scan for a wrong patient. And then I don't feel safe driving home after working 24 hours. Like, it's a 20-minute commute. Like, I don't want to hit anyone on the road. Yeah, so I could do that anonymously. I could do it after I graduate, turn around and say, like, you know what? I went through that, no more. Now I have the power, and I'm going to say, like, we need to fix this. We need a night float system, no more 24s. But if I spoke up right now and, like, identified myself as, like, this is my concerns, I would be at risk of losing my job. I would be seen as, like, oh, that's a difficult resident. Like, why can't she do this? Everyone else can do it, That puts me at risk. And then if I don't finish residency, I got these $200,000 of loans, like, I'm never gonna pay back, right? So it's 50 shades of unethical. The bottom line is there is often no perfectly ethical course of action within the constraints of a system that is unethical to begin with. Yeah. Okay, so it is mentee o'clock. We're gonna go back to that link. So, of these four, autonomy, beneficence, non-maleficence, and justice, what do you think is most important or salient in your field, and why? So I want to hear from you. What is an ethical dilemma you faced already in your careers as students, in class, in an internship, or in a job, even if it was in high school? Like, tell me about something that really threw you. Should I read these out loud? So Lockheed Martin, that's very open-ended. I don't know what that is. It sounds bad. Similar to my situation, a coworker talked bad about a patient. Was it in front of them? Was it behind closed doors with their therapist? There can be avenues where you can voice your frustration. Racism, so vague. That's real. Mandatory night shifts as a student. Oh my God. So you're going to work and then you're going to school the next day. Jeez. That's a 24. Getting off work on time, leaving my coworkers without help because you're late to your classes. Okay, so that's a tricky dilemma for sure. It's am I doing harm to myself by missing out this required class, putting my grade at risk? Am I doing harm to my coworker? And balancing that. Working a job for a year and new hires were getting paid more than me for the same work. Are you a lady? Yeah, goddamn. Had to talk to my boss, turned out to be a corporate error. Okay, so which ethical principle is that? Justice, right? Answering phone calls from nurses about a patient's diet, that's for changing the diet or sending one up. I don't see the ethical dilemma. Does anyone want to comment on what they meant? It's cool. Defense industry. Oh my God, that's real. This is my job and I really like it. And also, am I killing people? Yeah. That's gotta be a struggle. A lot of people leave that industry early. Shifts that went late into the night when I would have a morning shift that, oh God. Yeah, morning shift the next day. Yeah. It's doing harm to yourself. And that's an ethical violation too. Not treating your own body with kindness and love. Yeah. Managing employees who cannot come to work due to issues in their personal life, determining consequences. Ooh, do I punish you because your grandma passed away and you had to fly to Michigan for her funeral? Woo! Yeah, that's tricky. But then if people are not communicating when they're going through that, it's yeah, that puts you in a tough spot. I hear you. My junior year of high school, I worked in a fast food restaurant. There were many rude customers. Trying to remain calm and be nice, as you're actively ridiculed by a customer. Yeah, girl, you don't get paid enough to be nice to these people. You can set a boundary, okay? Someone in my town last week got shot in Chipotle because they were arguing about guac, and the guy jumped behind the counter and was trying to get the guac, and the guy, the worker shoved him. It's babe, at that point, you don't, that's out of your hands. Chipotle's not paying you enough to defend the guac. Okay, so yeah, you don't have to be nice, okay? Please. Dealing with coworkers in a hospital that are rude to you, that can have a lot of layers, right? Why are they rude specifically to you? Is it an identity that you have? Probably, right? Okay, had a coworker that was underperforming, holding back the team, struggled to report the problem because they were my friend. Yeah, that's hard. Because you don't want to harm your friend, the non-maleficence, but also they're not pulling their weight, the justice, okay? And picking which value matters more to you. That's real. Classmates cheating off my test. Oh my God, someone would get decked if that was me. Yeah, that's wrong. Because which ethical principle is that? Probably just non-maleficence? Actually, I'm not sure. Anyone can feel free to speak up. Okay, don't be shy. Having my mom help me with my essays, nice. Yeah, that's tough, because honestly, like in high school, my mom had to sometimes help me with my like Spanish homework. She didn't speak a word of Spanish, but they were like crossword puzzles that she could do crosswords, and I'd be like, I gotta do the real work, Ma, can you do these? So yeah, feels a little wrong, but gotta do what you gotta do sometimes. Bias towards gender or race. Yes, so that goes with justice, non-maleficence, kind of our AI example too, of like identifying like the black individuals with AI as like more frequently misidentifying them as the suspect. Yeah, you'll keep seeing that forever, you guys. Yeah. Every time I walk into a patient's room, I get the "what are you?" Like, what are you, Natalie? You have a white name and a beige face. Like, what is happening? Yeah. Thinking of hacking Purdue because I got a bad grade. What's /HJ? Maybe a typo? Or maybe a reference, I don't know. But yeah. That's just spiteful. But yeah, Purdue could take you. Sorry. Okay. Now some reflection questions that you have your little papers. About a time you've stayed silent and wished you had spoken up. A time you've spoken up and wished you kept your mouth shut. And then like any regrets on either of those, I'll give you guys a couple of minutes to jot some thoughts down, okay? That's just for your own like reflection and learning and like growth moving forward. Okay, and you guys can feel free to send some questions up there for like any final reflections, takeaways, questions, thoughts, feelings. Okay, so someone asked about some clarification on the concept of autonomy. That's a great question. So autonomy is like your right to make your own choices. Your right to like make decisions regarding your body, in my field at least, and like what happens to you. Yeah, so with the example of the mammogram, like I'm like, okay, you gotta do this, okay, you got it? And like, they're like, no, like that's not my values. Like if I had cancer, I don't think I would wanna treat it. But then you gotta dig deeper, like if you had cancer, would you wanna know? We can still diagnose it, like, you know? So they can choose their own adventure. I hate saying that, but it's real. Like making your own choices. Like your doctor can give you like your choices, your options for this treatment or lack thereof, and say like, okay, so if you don't treat this, here's what will happen probably, based on my training. And if you do, like, here's how painful chemo is, how much that sucks, and like, how will your quality of life be? So with autonomy, informed consent is like so huge. People have to understand exactly what are my options, and it has to be in words that make sense to them, or a language, if they speak a different language. You can't just put people through something that they have no idea. Or sell them this treatment that like, oh, I think this treatment will work, and I'm not going to tell them about this, the most common treatment or whatever. Like, yeah, you got to lay out the choices here. Are there topics or situations worth speaking out against despite any potential consequences? Yeah. I would say so. I mean, that's why like activists get arrested, right? They don't like, yeah. Think about like what those would be for you. What are the absolute like non-negotiables? What are you always going to speak up for? Just like think about that. Ooh, non-maleficence in the tech sector? I think we kind of covered it back there, sort of, with your AI example. Any other examples? My brother's an engineer. I should have like asked him, picked his brain before this. Yeah, I guess like my mom works on like the consoles and the vehicles. I have no idea what she does, over my head. But yeah, she's always like, oh yeah, we have to make it super hack proof, because if like you know, have a weak spot and a hacker could hack in and like drive the car like into traffic, like that's putting their lives at risk. So being really thorough about your job, not cutting any corners, could be your example of non-maleficence. Like, I don't want to harm the consumer with my product. Or the example of the defense industry. Yeah. Okay. What to do if a customer or client talks to you in a rude way that's snobby? How do you react? Is it right for you to talk back to them or get the person in charge? Oh my goodness. Okay. So actually, a month ago, there's a medical scribe, which is someone who is like maybe in their gap year, maybe at the end of undergrad. They're paid to follow around the ER doctor and like write their notes. And this is when I was working like 21 days straight, and I was like dying, and I was just like not on my game, and I was like, I don't want to be here. And so this scribe like was talking bad about me, saying like, oh, I'm the worst intern they've ever seen, and like da da da. And like an attending overheard it, and then that next week I worked with that attending, and they were like, you're better than I thought. And I was like, what do you mean? Like, where's that coming from? Better than what? And they're like, oh yeah, this scribe said this and that. And so I was like so furious. I practiced what I was going to say in the car to the scribe, because he had just gotten to pharmacy school. So I was like, if you're treating women in the workplace like this, I'm sure your pharmacy school is going to get wind of it. I'm like so furious. And oh my God, his face when I was like telling him all this looked like he was going to pee, poop, puke, pass out all at the same time. And then I realized like, oh God, there's a power differential here, and I should not, as the doctor, I should not have done that. Like, foot in mouth moment, huge regret. So be aware of any power differential that there might exist when you're responding to someone who's being like awful to you. And so I asked my supervising, like my mentor in my residency program, like, what do you do in this situation? And they said, go up. You never punch down or go down. Like, go up to their boss, the boss will handle it. Like, move on, chip off, you know, it just, yeah. And it can be hard to let stuff go if you're like, oh, this feels like an attack on me and my character and how hard I worked to get here. And it's like, yeah. It takes a lot of chill to get through. But like, if a customer's being rude to you, I feel like you can set a boundary and be like if I'm with a patient and they're yelling at me or I feel unsafe, I'll be like, either like, ma'am, I really care about everything you're telling me, but I want to take a pause, a couple deep breaths, and then like get back to this. Or like, ma'am, I don't really want you to yell at me right now, and I'm uncomfortable with this. I might need to step out. So just like communicating how you feel without the explosiveness happening in your head, just like simmer it down. It's practice. Did you take ethics courses as a med student? If so, how did you take what you learned in them and apply them to your rotations? I think like ethics was kind of sprinkled in sometimes. And they were nice because we would meet in a small group setting, like 10 of us, and go through cases and like role play, which is super cringe, but it actually was helpful when I got to my rotations of like, oh, I've been trained in this. I know what to do. It's a little scarier on a real person. Just like how CPR on a dummy is like, there's nothing like doing CPR on a person, but yeah. So just like working with your friends, like working with your colleagues or other students on like how to navigate these situations, debriefing, and practicing. There's no shame in like a little role play to figure this stuff out and like figure out your words. So yes, with that is the end. If you need to contact me for anything, have questions, this is my info. Yeah, and thank you so much for your participation and attention. I hope you guys have a great weekend and get out and enjoy the sun.